Did you know that something as small and seemingly harmless as the presence of proteins in your urine could be a silent warning that your health is at risk? Proteinuria, as this condition is known, may seem like a minor detail on a routine test, but don't be fooled, it is one of the first signs that your kidneys may be struggling and that something much more serious could be happening inside your body. In the United States, millions of people live without knowing they have elevated levels of proteinuria, a problem that often goes unnoticed until it is too late. And the worst part, proteinuria is not just a symptom, it's a warning that your kidneys could be on the verge of collapse. Chronic kidney disease, hypertension, diabetes, and even total kidney failure, all these problems can start silently, with just a few molecules of protein leaking into the urine. And the truth is, if you don't act quickly, the situation can become irreversibly worse. But don't worry, there is a natural way to fight this condition and transform your kidney health. Some vitamins can help reduce proteinuria levels, protect your kidneys, and even improve your overall health. In today's video, we will discuss the vitamins that truly make a difference. The last vitamin we'll discuss is the best one for lowering proteinuria levels and protecting your kidneys once and for all. Stay with us until the end to find out which vitamin could be the real secret to saving your kidneys and transforming your health. Before we begin, make sure to subscribe to our channel and hit the bell icon to get more valuable health tips. You won't want to miss the next video, which could be just what you need to live a healthier, more vibrant life. Number 1, Vitamin B9. Vitamin B9, also known as folate in its natural form and folic acid in its synthetic form, is an essential nutrient that plays crucial roles in the human body. This vitamin is fundamental for DNA synthesis and repair, the formation of new cells, and the production of red blood cells. Vitamin B9 is particularly important during periods of rapid growth, such as pregnancy and childhood, but its impact extends beyond these life stages. Recently, it has been studied for its role in protecting kidney health, particularly in reducing proteinuria levels, a marker of kidney damage. Vitamin B9 is vital for the production of red blood cells, preventing megaloblastic anemia, a condition in which the blood does not carry oxygen efficiently. It is also essential for the synthesis and repair of DNA and RNA, which is crucial for cell division and growth, especially in tissues that renew quickly, such as the skin and gastrointestinal tract. In addition, vitamin B9 plays a key role in metabolizing homocysteine, an amino acid that, at high levels, is associated with an increased risk of cardiovascular diseases. Folate deficiency can lead to the accumulation of homocysteine in the blood, increasing the risk of atherosclerosis and thrombosis. Thus, an adequate intake of vitamin B9 helps maintain cardiovascular health. In the context of kidney health, vitamin B9 is particularly relevant due to its effect on regulating homocysteine levels. Hyperhomocysteinemia, or elevated homocysteine levels in the blood, is frequently observed in patients with chronic kidney disease, CKD, and is associated with an increased risk of cardiovascular events and the progression of kidney disease. Folic acid, the supplemental form of vitamin B9, is used to reduce blood homocysteine levels, helping protect kidney function. Patients with CKD often have a deficiency in vitamin B9 due to reduced dietary intake, loss of appetite, and the use of medications that interfere with folate absorption. Folic acid supplementation can help correct this deficiency, reducing homocysteine levels and, consequently, the risk of cardiovascular complications and further kidney damage. Proteinuria is the presence of abnormal amounts of protein in the urine and is an important marker of kidney damage. Vitamin B9 can play a significant role in reducing proteinuria levels in patients with kidney disease. Hyperhomocysteinemia has been linked to increased proteinuria and declining kidney function. Since folic acid reduces homocysteine levels, it can indirectly help decrease proteinuria. Clinical studies suggest that folic acid supplementation may reduce proteinuria levels in patients with CKD, especially those with hypertension or diabetes, conditions often associated with increased homocysteine. Reducing homocysteine levels can improve the health of blood vessels in the kidneys, reducing intraglomerular pressure and consequently decreasing protein excretion in the urine. Additionally, vitamin B9 has anti-inflammatory effects that can help reduce inflammation in the glomeruli, the filtering units of the kidneys. Glomerular inflammation is a contributing factor to proteinuria and the progression of chronic kidney disease. By mitigating this inflammation, vitamin B9 can protect kidney structure and function, reducing the excretion of proteins in the urine. For healthy adults, the recommended daily intake of vitamin B9 is 400 micrograms. However, for patients with chronic kidney disease or elevated homocysteine levels, higher doses of folic acid may be recommended to effectively lower homocysteine levels and improve kidney health. In many cases, doses of 800 to 1000 micrograms per day of folic acid are used to achieve these benefits, always under medical guidance. Folic acid supplementation should be individually adjusted, considering serum homocysteine levels, kidney function, and the presence of other conditions such as cardiovascular diseases. Prolonged and excessive use of folic acid can mask vitamin B12 deficiency, another essential vitamin for neurological and hematological health, so it is important to take supplements under medical supervision. Vitamin B9 is widely available in various foods. Among the main natural sources are leafy green vegetables like spinach, kale, lettuce, and broccoli. Legumes such as beans, lentils, and chickpeas are also rich in folate. Citrus fruits like oranges, strawberries, and melons, as well as avocados, are good sources of this vitamin. Fortified foods like breakfast cereals, bread, and pasta often contain folic acid, making them an important additional source of vitamin B9 for many people. Liver, while an excellent source of folate, should be consumed in moderation, especially by patients with kidney problems, due to its high protein content and potential to raise uric acid levels. Number 2, Vitamin E. Vitamin E is a fat-soluble nutrient that plays several important roles in the human body. Its main function is to act as an antioxidant, protecting cells against damage caused by free radicals, unstable molecules that can cause cellular injury and contribute to the development of various chronic diseases. Additionally, vitamin E has anti-inflammatory properties and strengthens the immune system, which can provide significant benefits for overall health, including kidney health. Vitamin E protects the body's cells by neutralizing free radicals, molecules that can damage proteins, lipids, and DNA. This antioxidant effect is particularly important for cardiovascular health, as it helps prevent the oxidation of LDL cholesterol, reducing the risk of atherosclerosis, which is the hardening and narrowing of the arteries. Moreover, this vitamin has positive effects on the immune system, helping to defend against infections and regulate the body's inflammatory response. Vitamin E also plays an important role in skin health, protecting against damage from sun exposure and aging, and in vision, potentially preventing or slowing down eye diseases such as cataracts and age-related macular degeneration. When we talk about kidney health, vitamin E stands out due to its antioxidant and anti-inflammatory effects. The kidneys are organs with a high blood flow and a dense network of blood vessels, making them particularly vulnerable to oxidative stress. Oxidative stress occurs when there is an imbalance between the production of free radicals and the body's ability to neutralize them. This imbalance can cause damage to kidney tissue, promote inflammation, and contribute to the progression of chronic kidney diseases. Due to its antioxidant properties, vitamin E can help protect kidney cells from such damage. Studies with patients who have chronic kidney disease have shown that vitamin E supplementation reduces markers of oxidative stress and inflammation in the kidneys, potentially slowing disease progression. Proteinuria, which is the presence of abnormally high levels of protein in the urine, is a key indicator of kidney damage. Vitamin E can help reduce proteinuria due to its antioxidant and anti-inflammatory properties. By reducing oxidative stress and inflammation in kidney tissues, vitamin E contributes to preserving the integrity of the glomeruli, which are the structures responsible for blood filtration in the kidneys. Glomerular damage is a major cause of proteinuria. When the glomeruli are damaged, they become more permeable, allowing proteins to pass from the blood into the urine. Vitamin E, by neutralizing free radicals and reducing inflammation, can protect the glomeruli, thereby decreasing the excretion of proteins in the urine. Clinical studies on patients with chronic kidney diseases have shown that vitamin E supplementation can lower proteinuria levels. For example, research conducted on patients with diabetic nephropathy demonstrated that those who took vitamin E supplements had a significant reduction in proteinuria levels, indicating a protective effect of the vitamin on kidney function. To improve kidney health and reduce proteinuria levels, the recommended intake of vitamin E can vary depending on the patient's age, sex, and health condition. The daily recommended dose for most adults is 22.4 IU of vitamin E. However, higher doses, typically around 400 IU per day, have been studied in research involving patients with kidney disease to evaluate their benefits in reducing oxidative stress and proteinuria. It is important that vitamin E supplementation is done under medical supervision, as excess vitamin E can interfere with blood clotting, especially in people taking anticoagulants, increasing the risk of bleeding. Additionally, high doses of vitamin E can, paradoxically, increase oxidative stress in some individuals instead of reducing it. Vitamin E is naturally found in many foods, especially those rich in healthy fats. Good sources of vitamin E include vegetable oils such as wheat germ oil, sunflower oil, safflower oil, and soybean oil. Nuts and seeds, like almonds, hazelnuts, and sunflower seeds, are also excellent sources. Leafy green vegetables, such as spinach and broccoli, provide moderate amounts of vitamin E, as do fruits like avocados and kiwis. For those who cannot get enough vitamin E through their diet, supplements may be an option. However, it is crucial to discuss this with a doctor before starting any supplementation, especially for patients with underlying health conditions, including chronic kidney disease. Now, it's time to reveal the final vitamin in our video, but before that, we want to hear from you. Give us a like if you're enjoying the video, comment below which food you think will be the most powerful on our list, and don't forget to subscribe to our channel for more content like this. Now, let's discover which vitamin will transform your kidneys and lower your proteinuria levels. Number 3, Vitamin D. Vitamin D is an essential nutrient that plays several important roles in our body. Many people associate vitamin D primarily with bone health, as it facilitates calcium absorption in the intestines and helps maintain bone density. However, its benefits go far beyond that. Vitamin D is also crucial for the proper functioning of the immune, cardiovascular, and muscular systems, and, especially, for kidney health. Vitamin D helps regulate the immune system by promoting defense against infections and reducing inflammation. Studies also indicate that it plays a role in preventing chronic diseases such as diabetes, high blood pressure, heart disease, and certain types of cancer. In the cardiovascular system, vitamin D helps regulate blood pressure and maintains endothelial function, which is essential for blood vessel health. Additionally, vitamin D plays an important role in muscle function, preventing weakness and falls, particularly in the elderly. A vitamin D deficiency has been linked to problems such as muscle pain and an increased risk of falls and fractures. When it comes to kidney health, vitamin D is particularly significant. The kidneys are responsible for converting vitamin D into its active form, calcitriol, which is essential for various bodily functions. Vitamin D helps regulate calcium and phosphorus homeostasis, both of which are vital for bone health. Moreover, its active form has direct effects on kidney health, helping regulate blood pressure and kidney inflammation. Proteinuria, or the presence of protein in the urine, is an important sign of kidney damage. Vitamin D can help reduce proteinuria levels in patients with chronic kidney disease. This occurs because the active form of vitamin D, calcitriol, has anti-inflammatory and antifibrotic effects on the kidneys, decreasing the activity of the renin-angiotensin-aldosterone system, which is a major contributor to increased pressure within the kidney glomeruli. This reduction in pressure lowers the loss of protein in the urine. Furthermore, vitamin D can also help protect podocytes, which are specialized kidney cells responsible for filtering the blood. Preserving these cells is crucial for maintaining proper filtration function and preventing excessive protein loss in the urine. Clinical studies suggest that vitamin D supplementation in patients with chronic kidney disease can significantly reduce proteinuria levels, slowing the progression of the disease. To maintain kidney health and help reduce proteinuria, the recommended amount of vitamin D varies depending on age, sun exposure, and specific medical conditions. For most adults, the recommended dose of vitamin D ranges from 600 to 800 IU per day. However, for patients with chronic kidney disease or other conditions that affect vitamin D absorption, higher doses may be needed, under medical supervision. It is important to remember that the need for vitamin D supplementation should be assessed individually by a doctor, who will consider the patient's blood levels of vitamin D, kidney health, diet, and lifestyle. Excessive vitamin D, also known as hypervitaminosis D, can lead to serious complications, including hypercalcemia, elevated calcium levels in the blood, which can negatively affect the kidneys and other organs. Vitamin D can be obtained from three main sources: sunlight exposure, food, and supplements. Sunlight exposure is the most effective natural source of vitamin D, as ultraviolet B rays from the sun stimulate vitamin D production in the skin. It is recommended to get about 15 to 30 minutes of sunlight daily, especially during times when the sun is lower in the sky, such as early morning or late afternoon, without excessive sunscreen, to optimize vitamin D production. Among foods rich in vitamin D, fatty fish such as salmon, sardines, mackerel, and tuna stand out. Other foods containing vitamin D include cod liver oil, egg yolks, sun-exposed mushrooms, and fortified foods like milk, orange juice, cereals, and yogurts. For patients with dietary restrictions or low sun exposure, vitamin D supplements can be an effective alternative. We've reached the end of our video, and now you know the vitamins that can make all the difference for your kidney health, helping to reduce proteinuria levels and protect your kidneys from more serious issues. Remember, proteinuria is a warning sign, and it's crucial not to ignore it. By incorporating these vitamins into your daily routine, you not only reduce the amount of protein in your urine but also strengthen your entire renal system, protecting your kidneys and, ultimately, your overall well-being. Keep following our channel for more practical and valuable health tips. Don't forget to like the video, share it with someone you care about, and of course, subscribe so you don't miss any updates. Thank you for watching until the end, and see you in the next video.